Jai Hind everyone. I am Priya from the Raksha University and welcome to Suraksha Dialogues, the conversations that matter. And for that, I am your host for the podcast where we are going to dive deeper into a topic which is generic and stigmatized at the same time, psychology. And for that, we've got our guest, Dr. Abhijeet Singh, who is an assistant professor in the Raksha University and also the course coordinator for the bachelor's program. So, Jain sir,
Jai Hind.
would you like to, just give a brief introduction to our guests?
Sure. Hello everybody, myself Dr. Abhijeet Singh. I am working as assistant professor in psychiatric social work in School of Behavior Sciences and Forensic Investigation, RRU. Prior to this, I was working in Central Institute of Psychiatry in drug de-addiction program as a supervisor in psychiatric social work field.
Yeah. So we've got sir who's covered actually a lot of areas, and he's also currently working in the prisons, right, along with
Definitely.
the RRU. So yeah. Anyway, sir, as you mentioned that you worked as a psychiatric social worker, right? And I think a lot of us, even before joining the field and now as well, we've got a confusion between psychiatric social work, psychiatry, and psychology. So would you just help us differentiate between these two?
Definitely, definitely. So, whenever a psychiatrist, a psychiatric social worker, and a psychologist working together, the team is known as multidisciplinary clinical team. So, here a psychiatrist, a person who is into giving a diagnosis. Also, a psychiatrist can give medicines and different type of drugs. When it comes to psychologists, persons who are trained in psychology, who has done their clinical psychology, MPhil in clinical psychology, masters in psychology, and PhD in clinical psychology, they are termed as clinical psychologists. Persons who are into testing, who are into assessing the personality part of an individual, or persons with mental illness.
Yeah.
A psychiatric social worker is a person who is looking after the individual persons with mental illness, as well as the caregiver of their particular person. So when a psychiatric social worker is definitely a person who is seeing the family part of that particular individual.
Yeah. So basically, psychiatrist is the one who can prescribe medicines, right?
Medicines.
And psychologist who can do the
Do different kinds
counseling.
of
Yeah.
counseling, different kinds of personality test,
Yeah.
and a psychiatric social worker is a person who is into family,
Yeah. So a group work
group work
basically. Yeah.
basically.
So, sir, would you, let us know how psychiatric social work is as important as the rest of the two?
Here I would like to quote a model. The model is known as psychosocial model. This
Yeah.
was given by Gordon Hamilton. And this model talks about that whenever we are seeing an individual, individual means a person with mental illness, his social context should also take into consideration, because sometimes the stress, the anxiety related to that particular individual comes from the family. So if we are seeing the family, so we are giving a good comprehensive treatment to the individual as well as his family as a part.
Okay, yeah. So now you are handling the patient as well as the external caregivers or the primary caregivers,
Definitely,
right?
definitely.
Oh, okay, okay, okay. And sir, like, what is actually a mental illness according to you?
Uh, there are different definitions given by different books and manuals, but in nutshell, in layman language, mental illness is a problem which arises from the cognition. Whenever you are unable to use your resources, the nearby resources,
Yeah.
to its fullest level, a mental illness
Arises.
arises.
Yeah, yeah. And sir, what do you have to say about psychology as a subject? When you study it.
Psychology as a subject is really very different, because it gives you a good knowledge about the human psyche, the cognition part, as well as it also helps you to understand the kind of thought process you have and how you see yourself as an individual.
Hmm.
So it gives you an opportunity to understand you as a different entity.
Yeah, okay. And recent we've got like this is a very controversial thing. Psychology as a subject of arts or a science. So, what do you have to say about that?
Yes, this was a controversies, but now as per the new guideline of NEP, that is National Education
Yeah.
Policy, as well as the NCEHP guideline, the name of the course is Bachelor's in
Psychology.
Psychology program, which is a field of Bachelor's of Science, that is BSc Psychology. So
Yeah.
it is again a stream of science, not a
Yeah.
stream of
Arts.
arts.
So, sir, how would you explain psychology as a science?
Definitely, psychology is a science because you try to understand the human psyche,
Hmm.
the cognition, the kind of thought process they are going into, and we have different theories like Sigmund Freud, one of the
Yeah.
greatest theory we know, that Sigmund Freud's theory. So if you read all this is
Hmm.
again an important part of science, and again psychology and mental illness are definitely related to each other, because whenever we are suffering from any severe mental health disorders, be it schizophrenia, be it bipolar affective disorder, be it anxiety spectrum disorder, psychology came into play, because your thought process, your decision making process, everything is you know is it in problem.
Yeah.
So psychology as a science definitely is a true statement.
Yeah. So basically, it's something which can be observed and measured at the same time, right?
Definitely.
And sir, like, what could you just brief us about the scopes after bachelor's, master's, MPhil, and even PhD?
Uh, as far as my experience is concerned, after bachelor's, the scope of psychology is little,
Hmm.
because the bachelor's in your bachelor's degree, the focus is more on the theoretical part and less on the practical part.
Yeah.
So after completing bachelor's, a person is not enough mature to handle a particular
Patient. Yeah.
case, a particular patient. So definitely completing masters will give you a different layer of knowledge,
Hmm.
because after your masters you are well aware about the research in psychology, about the therapy part, about the psychotherapy, how it takes into consideration. And after completing masters, definitely you can go for different counselor job, in which school counselor job is one of the very common job which is available in different parts of India and abroad also. And if you are if you are interested enough to complete your MPhil and PhD, definitely you can go for as a consultant, as a faculty job in different hospitals as well as in different universities.
Yeah.
So the field of psychology is really very vast, but again you need to have that kind of a knowledge as well as the experiences. One thing which we say in psychology, that the knowledge is important, but again experience adds different layer to your
Yeah.
knowledge base.
Yeah. And sir, I mean, how is the curricular of masters different to that of an MPhil?
Okay. So in master, uh, I can say that masters you read about the theory part
Hmm.
as well as practical part,
Yeah.
but the exposure of hospital or the exposure of different clinics is less.
Okay.
But when you come to MPhil, it's like a 60-40 ratio. 60% is exposure to hospital based treatment, 60% exposure to clinical assessment and intervention, and 40% is the theory part. So definitely, nutshell, in masters you are more groomed on the theory part, but in MPhil you are more groomed towards the clinical part, towards the practical part,
Yeah.
in which hospital, different clinics, different private clinics, de-addiction center comes into play.
And sir, how does PhD benefit to all of that?
PhD is definitely a research-based course where you go for a particular, you take a particular topic and you do a lot of research in that, and that's add knowledge to your area. And definitely, PhD helps you to find that in psychology what is the area you are going to work. It will develop your area of knowledge. It will develop your area of expertise.
Okay.
So a person who has done research in CBT, he or she can say that I am an expert in CBT because I've done my PhD, I have invested that many of years. So definitely PhD adds uh, uh, expert expertness towards your field.
Yeah. And sir, all of the courses that are later mentioned, right? RRU is, providing all of them. So, how is RRU unique at it?
Definitely a very great question. RRU is very unique because the kind of courses RRU is offering, it is offering courses on forensic psychology, it is offering courses on criminal psychology, it is offering courses on victimology and rehabilitation. So RRU is tapping all the important areas of psychology, and a person who is completing his tenure from RRU will be well versed with different forms of psychology. And the best part about RRU is that all these important courses, the RRU is launching from the bachelor's only. So from the infancy state only, a student get exposure of so many area. And also the student is well versed with the research processes and research area. So definitely this will add knowledge base to that particular individual.
In the sense, the exposure is really there. Right?
Definitely, the exposure is there. One thing I want to add to your question is we have different faculties from different genre. For example, we have faculties from forensic psychology, I'm a faculty from psychiatric social work, we have faculty from clinical psychologists, we have faculty from psychology also. So different array of faculties, expertise people we have, and definitely their knowledge is going to help the individual to grow as a professional.
So basically the subjects the courses have, it has got everything, or it will build up a nice base when
definitely. For example, if we take an example of sports psychology, so we have courses related to sports psychology, and we have dedicated faculties. So a person who has completed his sports psychology honors or a master's degree can definitely go for different kind of job options related to sports. And he can be a mentor in a cricket team, in a football team, and can help an individual. So definitely the field is very vast, and RRU is giving you the opportunity to go and cash it out.
Like especially bachelors, when I was going through the curriculum prior to the podcast, I found out that it has got specializations in like military, neuro, sports, forensic, and school as well. So the students would actually get a thing before they step into their masters. They actually know what's for them and what's not, right?
Definitely. Just want to add on what you said. I am the course coordinator of Bachelor's in Psychology program right now. Okay. So right now I am teaching my students about the research methodology part. Definitely. In next semester I will be teaching them about the abnormal psychology. Okay. So now they know like in research they know what is the prevalence of abnormal psychology in India, what is the prevalence of mental disorders in India. In research they will know. And in next semester they are going to do the assessment and interventions in mental illness patients. So you see what kind of planning RRU is having. Means it is paving a good way for the for the freshers to come upon and to excel in their field. So the course curriculum is very comprehensive, and the kind of knowledge RRU is giving is definitely going to help a lot.
I get that. And sir, there's also another course which I came across, which was just for a year. I think advanced professional diploma in clinical and forensic psychology. So what is actually taught in that course, and how does that work?
Definitely, I was very fortunate enough to supervise few of the APD students when I was posted in hospital for mental health as well as prison mental health. So here the students are posted, and they are doing their research activities in prison mental health. Okay, and also they are taking classes on psychology. So the theory part is also they are well versed, practical part also they are well versed, and they are also doing their research activities. So after completing the APD, that is advanced professional diploma, they will have a hands-on experience on how to treat patients with mental illness, how to do the assessment part, and also do the intervention part.
And all of that just in a year course, right?
Definitely, in a 1 year course they are getting so much of exposure. So definitely this is a very good course which RRU has launched. I have not heard of this course anywhere else. So this kind of exposure RRU provides.
And sir, what is actually studying psychology according to you?
So psychology is a amalgamation of different stuff. First, it is an amalgamation of your thought process, the cognition, emotions, behavior, as well as your cognition as a whole. It also talks about the research, psychology as a research.
Yeah.
Also, it talks about the assessments, the interventions which is necessary in severe mental health disorders, in common mental health disorders, in anxiety spectrum disorders,
Yeah.
as well as psychology provides you to deal with a person who is in problem.
Okay.
How you will start a conversation, how you will start a therapy sessions, how you will just give supportive counseling to a particular individual. So this all comes in psychology as a
Of
course.
course.
So
Yeah.
if a person is enrolled in this course, and after completion of this course, he or she will be well versed with supportive counselings, with providing CBT, with providing psychotherapy, with providing counseling, and all this will help the individual to develop the mental well-being,
Yeah.
which is one of the most important criteria or most important thing to talk about in this
New era.
recent
Yeah.
scenario, in this post-COVID era.
Yeah. So in the sense, psychology is actually a scientific aid, and
Definitely, ma'am. Just I want to add on one thing.
yeah, yeah, sure,
Yeah,
sure.
when the COVID came, we all were stuck with that particular phase. It was
Yeah.
really a very,
A hard time. Yeah.
hard time, a very stressful situation. And why we were stressed? Because we were not having any routine in our life.
Ah,
We
totally.
were not having any anchor in our
In
life.
life.
We were not knowing कि morning में हमें क्या करना है और
Yeah.
afternoon में क्या करना है. And people were not having anyone to talk. They were not going for a walk. Every time where they were stuck in a single room,
Yeah.
and that were creating a lot of stress in them. That was creating a lot of anxiety in them. So we in that time we proposed supportive counseling to those individuals through phone calls, through emails, through podcast.
Yeah.
And the impressive part was that it made a lot of changes in them. When a psychologist was talking to them, uh, few people were also having suicidal thoughts, that no one is there with them, loneliness is hampering a lot. And at that time, if a psychologist is talking to a particular individual, they were happy, they were about to come out from their stressful situation. So definitely, I must say psychology is not only a course, it's a lifestyle,
Style.
and
Yeah.
it's also a life-saving therapeutic statement.
Yeah, and since the last statement, it also reminds me, this is what actually Dr. S.L. Vayama, she quoted the same thing when it was our orientation in the first year of my bachelor's. Yeah, so it is definitely, it paves a path for you. It tells you what to do, what not to do. Since you are in that field. And sir, talking about academics again and the students, what do students usually expect when they are entering the field, and how does it turn out for them?
Definitely, a very tough question to answer, because now I'll be talking of some of the realities, and I don't know how the audience out there will react to this.
Yeah.
But again, this is based on my experiences. So when a person enters a bachelor's program, he or she has this notion that after completing the bachelor's program, he or she will be getting a good, handsome money, a good career, which is not possible
Right after the bachelor's.
right after a bachelor's. Because again, this I've mentioned before also, in bachelor's, we groomed you towards the theoretical part of psychology,
Yeah.
all the theories and models related to psychology. So after the bachelor's program, a person is well groomed with the theory part of psychology, but not the practical part. For having a good experience on the practical part, he or she must opt for higher programs like master's program or MPhil programs, because after completing your master's program, you will be well versed with the practical part of psychology,
Yeah, yeah, yeah.
where you will be knowing what kind of assessments you do in severe mental health disorders, what kind of interventions you do in common mental health disorders, how you have to face your client. If a client is coming with us with
Yeah,
one problem, what kind of talk therapy you can give, how you can comfort your client.
Yeah.
So all this comes with a practical knowledge
yeah.
of psychology, which only comes when you are a person who has completed your masters, or you are into your MPhil or PhD level.
Yes, sir. Basically, the students in bachelor's, they kind of hurry, right?
Yes, yes, I agree with you that they are in a kind of hurry, they're in a kind of rush that, okay, after completing this, I'll be a psychologist, I'll be a life coach or something like that. I will post pictures on Instagram and Facebook like I'm a psychologist. but it's not like that.
Yeah, it's
Okay,
deeper than
it's
we
deeper than it.
think.
If I'll give you an example, that psychology is just like the iceberg,
Yeah,
the tip of the
iceberg.
iceberg, है ना, which seems like this, but there is a lot of roots are there,
Inside that, yeah.
beneath the water.
Water,
So
yeah.
that you have to learn, and psychology is not about learning; it's about experiences, how you take care of your client. And one thing which I want to mention here, that in psychology, definitely books give you knowledge, but beyond books, it's your patient, it's your client who plays a very vital role. They act as your syllabus, they give you a lot of knowledge.
Yeah.
So always respect your client, always respect your patient, and try to learn as much as possible from them.
Yeah, and sir, I think most of the people who are in their MPhil or masters right now, or even bachelors, since they are in a hurry, but we have got the thing that how do we initiate the first session, which is very much important for the rapport building. So could you just explain more about it?
Uh, as far as my experience is
Yeah.
concerned, if you are able to build a good rapport with your patient, 50% of your case is over. You are in that success zone. Developing rapport is definitely a very Herculean task, a very difficult task, but whenever you're talking to a patient, try to maintain the eye contact. Once the eye contact is maintained, eye contact is just a replication of trust, that I trust you, you trust me. And once that trust is built up in a very comprehensive way, the rapport is built up.
Yeah.
And sometimes for rapport build up, we talk something which is out of the box. We talk
Okay.
about the patient, about their personal life, about their past life, about their other emotions. And sometimes this helps us a lot to develop the rapport part.
Yeah.
And once the rapport is developed, definitely the session is successful. But again, I will add on to this that rapport establishment is not a one-day session. It is a dynamic process. It keeps on changing with the flow of the session.
Yeah. So, sir, could you just give our viewers a tip about what not to do in your first session?
Okay, so what not to do? So if suppose a person who is taking drugs, let's say a person who is alcoholic in nature,
Yeah.
and he came to me in the first session, never ever say alcohol is injurious to you. Don't take alcohol. Never ever say this point. Why? Because uh, the the community from where the patient is coming, everyone is giving him or her the same suggestion.
Yeah.
Please don't take alcohol, it will ruin your liver. Please don't take alcohol, it will ruin your life. Now he or she is in the professional forum, and as a professional also, if I'll just cut copy paste the same statement, it will show that what kind of professional I am, because I'm just cut copying the same thing which the other community people are saying. So first, try to develop the insight that alcohol taking behavior is really affecting you. First, try to develop that insight that, okay, what you think about your alcohol taking behavior. Generally, we follow a pros and cons technique we follow in our therapy sessions, in which we provide a blank sheet to our patients. And we say them, you write two things about the benefits of taking alcohol, means pros and cons of taking alcohol, and pros and cons of not taking alcohol. So that is again exercise for self-reflection. When the patient starts writing, he or she feels that, okay, this is the benefit and this is the cost of taking alcohol. So these kind of things which we do, but again, this all comes with practice.
So in the first session, the thing is that accept them and then give the insights.
Definitely accept them as a person they are. Try to give them insight and never ever give advice. Or if you want to give advice in later sessions, try to give advice with certain evidence based stuff. That plays a very vital role.
And in India, we seem to take psychotherapy sessions or therapies in general as very lightly, very they don't take it seriously. They don't know its actual important? It's just a mere talk session to them or a talk therapy to them. Could you explain why? Why do Indians take therapy for granted?
Because we don't know what is the difference between a counseling, a psychotherapy, and just a advice giving session. For example, if you are not well, someone can tell you take some medicines,
Yeah.
you take some paracetamol tablets. People think that is a counseling. No, that is just a advice, a layman advice. Counseling, or when it comes to psychotherapy, it has some guidelines. It has some session guidelines. It has some kind of confidentiality in that. It has some kind of procedures which we have to follow. Counseling and psychotherapies are different because only a trained professional can give it. First, second, the setting should be very much quiet, and again, first we see the problem and then we try to give counseling based on the problem. So it is always a tailor-made approach. Okay, it's not like you are just quoting the bookish language and you're giving sessions. So first you have to understand the problem, analyze the problem, and then give your psychotherapy or counseling sessions. In India, we take it for granted because we think that for every problem there is a solution, and the solution should be very materialistic in nature.
So the medicines.
Okay, so if we are going to a psychiatrist and the psychiatrist is giving us medicines, we are okay, we have this medicine. But psychotherapy is also a medicine, but it is not in the physical form, but it is in the mental form. But again, it will take a lot of years, I guess, or a lot of more sessions to make people understand about the importance of counseling and psychotherapy and the importance of psychologists and other allied health professionals.
So, how can we psychoeducate people more?
So for psychoeducating people, definitely awareness program can one of the most important techniques that we can go for. Awareness programs, and then creating these kind of podcast can also help. Uh, again, talking to people, talking to different people, understanding their different psyche, understanding their problem, giving them the possible practical solutions can help us to develop awareness, to create awareness, and in that way we can take this profession to a much higher wings.
So, sir, what, according to you, is the current state of psychologists in India?
So the current state is not good, I would say, because what is happening, there is two important arms. The one is the psychologist, and one is a clinical psychologist. Okay, people who have done their masters, they are psychologists. People who are into clinical psychologists, they call them as a clinical psychologist. So few people thinks that I am superior, few of the lot thinks that I am superior. This should not happen. We all are a team of a multidisciplinary clinical team. We all are mental health professionals. We should respect each other. No matter, no one is superior. Not a psychiatrist is superior, nor a psychiatric social work is superior, nor a clinical psychologist or a psychologist superior. We all are a mental health professional. If there is a case, we should do our best. We should give our best, and then let's see that what differences we can make to that particular patient. In a patient, suppose there is a patient X, in that psychiatrist has a very important role because they are giving the medicine, so they are also important, and psychologist is also important because they are doing the testing part, and the psychiatric social worker is also important because he or she is taking the family into consideration. So everything should go in hand for a betterment of the patient and for the betterment of the well-being of that particular individual.
So the leonizing is very important.
Definitely, and again, one of the most important thing is to respect each other's profession.
So that is it, sir. Thank you so much for our part one.
Thank you for this opportunity. I think that with this podcast we can make some difference in our thought process. Thank you. Jai Hind.
So much, sir. So that was it for our first podcast, but definitely we're gonna get more. This was just the part one. So see you later. Jai Hind.